Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. So this is the time of year when we see a big increase in the number of colds and flu. This is especially true because it's right after the holidays when so many of us have spent time with friends and family. We have been maybe flying there and being exposed to a lot more people. It's also because of the cold air and the dry heat that so many of us have in our homes. So what can you do to cut down on the incidence of that, both through your team and with your patients coming in? So prevention, of course, is the number one thing. Being healthy, getting plenty of sleep, exercise, eating a good, healthy diet, all those are very important. But number one, best source of protection is easy and cheap, and it is to wash your hands a lot. Right? So in the office, you might want to consider even giving individual tissue boxes to patients who come in with colds or flu-like symptoms, and even maybe a surgical mask for them to wear. Now, if it happens to be one of your team, they could also wear a surgical mask around the office and carry their own individual Kleenex boxes, and that will help keep everything kind of contained for them. Definitely want anybody, whether it's a patient, parent, or somebody on your team, to stay home if they have a fever of 100 degrees or more. They actually need to stay home even one day past when that fever has gone back to normal. So I know we're all told to wash our hands a lot and keep from touching our face and our noses and our eyes and our mouth, but that's pretty difficult to do. So in a previous Pearl, we discussed how to deal with sick patients coming in and their parents and what you can do as an office to try to help isolate them to keep them from spreading it to other patients, but even more, keep it from spreading to your team. So let's go back to that hand washing. We know that that's the number one way to prevent the spread of germs. So if you look at the routine type of hand washing in the office, this has to do with just removing soil and topical germs. Now, this would be with water and just plain soap, and you would want to wash for 15 seconds. So these would be issues where you might do it in between patients, so you definitely would wash like that before you put your gloves on. You would wash again like that after you took your gloves off. You would also want to do that before you leave the operatory and before you leave the lab if you've been working in there. However, if you have barehandedly touched something that possibly is contaminated with blood or saliva, you need then to wash your hands in an antiseptic way, which is with antimicrobial soap. So the same thing would be washing for 15 seconds, but the soap would be the difference there, and that is going to help remove different types of flora that possibly are going to cause illness in your patient's parents or team. There's also the antiseptic hand rub that you can use in your offices, and that's great to be if they're just the alcohol-based, or if you want some that are a little bit stronger, you can get the ones with chlorhexidine or some other materials in there. But normally the alcohol-based ones are adequate. And I suggest putting them around your office in as many places as you possibly can. The key to that is that you want to put it on your hands and then rub your hands together until they are dry. So remember, when you're in doubt, wash your hands. That will help keep you from getting contact of germs from other people and keep yourself healthy, keep the team healthy, and help keep your patients and parents in your office healthy. I'm Dr. Rhea Hogseth. This is a Practice Pearl from the PDAA, and I'll see you on the next one.